Good evening. Mr. Pillay, Mr. De Silva, Mrs. Koh, distinguished speakers, ladies and gentlemen. I'm Greg Clancy, the Master of Tembusu College, and it's my pleasure to welcome you to the 7th Tembusu Forum. These forums, which occur twice every semester, are the flagship events of Tembusu College. Their purpose is to bring important thinkers and policymakers to debate or discuss crucial issues in front of a predominantly undergraduate audience. It's this last aspect, the undergraduate audience, that sets our forum apart from others that occur across this campus and in Singapore generally. Here, students at the undergraduate colleges at NUS get priority at the microphone to question our speakers after their talks. And I expect a lot of penetrating questions tonight because about 200 of you in this room are taking a senior seminar called Biomedicine in Singapore Society, and this forum could not be more timely or relevant to your theme or topic. It's always my pleasure at this point to hand the microphone over to the founder and the moderator of the Tembusu Forum, who's also, of course, the rector of our college, and the patron of at least half the good and progressive things that take place in Singapore. Ambassador and Professor Tommy Koh.
I'm afraid Greg had just confirmed my wife's reprimand that I've become a professional busybody. But since this is the 9th day of the Lunar New Year, I think it is appropriate for me to begin by wishing all of you a happy Lunar New Year. And welcome again to the 7th Tembusu Forum. We try to organize 2 Tembusu Forums every semester. And this is the first forum of this particular semester. Let me begin by greeting some important friends who are here. I'd like to begin by welcoming Mr. Edward De Silva, a member of the Board of Trustees of NUS. And I guess in a sense, he's the big boss of all of us. Then I would like to welcome somebody I've admired all my life, Mr. J.Y. Pillay, the rector of the College of Alice and Peter Tan, formerly known as Yangsana College. He's also, as you all know, the founder chairman of Singapore Airlines, of which we are all very proud of, and he's the chairman of the Council of Presidential Advisors. Next, I would like to welcome Professor Chia Kee Seng, the Dean of the Saw Swee Hock School of Public Medicine. Kee Seng, thank you for joining us. Next, I'd like to welcome Dr. Paul Tambyah's wife, Kuan, who is also a resident fellow of the College of Alice and Peter Tan. Kuan, thank you for joining us. And I would like to also welcome a very good and old friend, Mrs. Liana Tambyah, who's a leader in our VWO community. Liana and I are still campaigning for one specific change in our law. We want to remove the exemption of disabled children from compulsory education. We think disabled children, like non-disabled children, need to be educated. In fact, they probably need it even more. And to exempt them from compulsory education is, in our view, an unreasonable position. And finally, Dr. Wong Wee Nam, another very old friend, thank you for joining us. The purpose of this forum is to discuss Singapore's healthcare policy and values. I would begin by observing that in the social compact between the people and the government, jobs, housing, education, healthcare, and public transport probably are the 5 most important components. And I would say, without becoming politically partisan, that the Singapore government has done relatively well in all 5 areas. Indeed, in the case of healthcare, The WHO has ranked Singapore as having the world's 6th best healthcare system. And it is truly remarkable that we have been able to achieve this outcome by spending only 4% of our GDP on healthcare. In contrast, a country which I know very well, the United States, spends 18% of its GDP on healthcare. And some would say the outcome in America is not even as good as the outcome in Singapore. And obviously, the United States is not a model we wish to follow. But no country is perfect. No system is perfect. And no one would say that the Singapore healthcare system is perfect. It is not perfect. And the purpose of the forum tonight is to try to identify what are some of our shortcomings, what are some of our lacuna. It is to also take note of important changes in Singapore. Changes of demography, our aging society, changes of disease patterns, of which Giseng is the resident expert. And we need to then consider what are the viable options for solving our healthcare policies in the coming years. Finally, I would say that in all this, what we are seeking is a balance between efficiency and equity. That's the balance we want to strike. Equity and efficiency. We have 4 very good speakers this evening, and I will introduce them one at a time. We had a brief consultation upstairs, and it was agreed that Dr. Phua Kai Hong will go first. Kai Hong and I are very old friends. We worked together for several years at the Institute of Policy Study. He's currently the Associate Professor of Health and Social Policy at the Lee Kuan Yew School of Public Policy. I've asked Greg to give him 5 extra minutes because I've asked Kai Hong to do all of us a favor by explaining clearly but briefly the differences between the different schemes we have. MediSave, MediShield, ElderShield, MediFund. What's the difference between the 4 schemes? Kai Hong, you have the floor.
Thank you, Professor Tommy Koh, for the kind introduction. I was supposed to be the last speaker, I was supposed to fill in the blanks that the previous speakers could not do. But now I find myself having to do the overview. I think I'll require the next 1 hour. Thank you. Well, my original topic was basically healthcare policies and values in Singapore, balancing efficiency and equity in healthcare, valuing economic and social costs. That was supposed to be my last statement, after this forum. But now I find myself now having to explain to you now what is our current situation. So you bear with me. There's a slide that I have prepared that's coming along that will actually tell you my own concept of what the Singapore system is all about. Now, well, essentially the philosophy of the Singapore healthcare system, when we went through a 20-year national health plan that was begun way back in 1984. I still remembered in 1985 or 86 when Professor Tommy Koh came back as the director of the Institute of Policy Studies. We went through a few years of major, what was then known as privatization, but we very quickly retracted and went 180 degrees to call it corporatization. It was exactly the same kind of situation where we seem to have gone so far ahead in pushing for efficiency that we forget that healthcare is really all about balancing equity with efficiency. So what we have evolved over the years was that we said we wanted to avoid 2 extremes. We had evolved from a British-type National Health Service model, which is the welfare state National Health Service model, which is essentially tax-funded